All right, are we good to
All right,
go?
Mr. President, we're live.
Excellent. Good afternoon, everyone. It is a pleasure to see you all here at this end of June. It is amazing what a year makes. I think we have largely a lot of very good news from the data over the last few months. Maryland has hit an all-time low on COVID cases, on deaths, and we are seeing kind of the impact of public health at work. When vaccinations get in arms, people are safer, and the economy can reopen, and we are in a much better place. So public health was our economy, and we're seeing that happen on a daily basis. With the state of emergency ending on July 1, certainly that brings its own series of changes. And we look forward to hearing from the Secretary on kind of the impacts there. The only kind of flag that we are all sort of watching is this Delta variant, and all reports seem to be that our vaccines are a good protector against this variant, which continues the message that the faster we vaccinate everyone, the safer we all are. So with that, I want to hand it over to Mike Powell, who will give us a more detailed description of the data over the last month. Mr. Powell. Oh, and I forgot to mention today we will have Senator Addie Eckardt is joining us by phone this afternoon. She wasn't able to participate on the Zoom, but she is joined in by phone. Are we ready, Mr. Powell? Do we have you?
He just had a power flicker at his house, and
of course, naturally. Well, how about we flip things then? We'll go on the fly. Mr. Secretary, do we have your presentation ready? Jake, do we have that one available?
We're ready.
All right.
I believe they're handling it themselves.
All right, Mr. Secretary, over to you.
Great. Thanks, President Ferguson, and I appreciate the time, Senators. It's always good to update you on the progress, and the last time we spoke was back in May. I usually begin with an update on our numbers, but I want to get to them in a moment. I'd like to start today's session with a word about the serious risk that still exists for Marylanders who remain unvaccinated. We have made tremendous progress and have so far hit all of the milestones that the governor has laid out for us. COVID-19 hospitalizations, deaths, and our 7-day positivity rate are at record lows, as you mentioned, Mr. President, and they're trending downward. And we attribute this success to vaccinations. Right now, there are approximately 1.4 million Marylanders 12 and older who are still unvaccinated, however, and remain in serious risk of contracting and being hospitalized from COVID-19. If I go to the next slide, please. As you can see here, 97% of the new COVID cases in Maryland occur in people who are unvaccinated, and 89% of the hospitalizations are unvaccinated persons, and 89% of the deaths are in unvaccinated persons. So it's very sobering statistics. And if you're unvaccinated, you're also susceptible to the highly contagious Delta variant that was mentioned earlier, which emerged in December of 2020 and is now in 100 countries, including the U.S. Dr. Fauci noted last week that the Delta variant is responsible for 20% of the new COVID infections in the United States, and just 2 weeks ago it was only 10%. We're starting to see Delta variant cases in Maryland, and the Alpha variant still remains more prevalent at the moment. The governor's message has been very clear in that if for whatever reason any Marylander is still unvaccinated, they should get vaccinated as soon as possible because it's now easier than ever. If I get the next slide. So getting back to our metrics, we've now administered more than 6.82 million vaccinations. That's 72% of our 12-plus population and 74.4% of our 18-plus population. President Biden set a national goal of vaccinating 70% of adults by July 4th, and Maryland achieved this milestone by Memorial Day, which was the governor's goal. On the vaccine equity front, we remain a national leader, and I can't thank General Burkhead enough and her team for their work. We now rank third in the nation for vaccinating the state's share of the Hispanic population and sixth in the nation for vaccinating the state's share of the Black population. We also have vaccinated 91.7% of our 65 and older population. And on June 23rd, our case rate dropped below 1 per 100,000, putting us in the federal green zone. And we're only one of 3 states, including Vermont and South Dakota, who have accomplished this. Next slide, please.
Mr. Secretary, just very briefly, I think on the presentation, I think that you have it on your end, there is a live captions and subtitles.
Oh, okay.
If it hits the got it. It's just, there we go.
Got
Excellent.
it. Yeah.
Great.
Thank you for that, President Ferguson. Thank you. Anyway, just want to quickly give an update on the vaccinating Marylanders 12 to 17. We began when the Federal Food and Drug Administration authorized Pfizer for this population back in April. On April 6th, we opened up the eligibility for 16 and older and started vaccinating in our mass vac sites. On May 13th, we opened eligibility for 12 and older, and to date, we have vaccinated 222,000 of the slightly more than 455,000 Marylanders who are 12 to 17, and that's 48.8% with at least 1 dose. We're making steady progress and still have a ways to go, and we're going to continue bringing vaccination where people are, such as sports clinics. But they can also get vaccinated anywhere the Pfizer vaccine is available, including local health departments, pharmacies, and hundreds of other locations. Next slide. So, question is, how are we going to reach the unvaccinated Marylanders that I talked about earlier? We have an in-depth understanding of where unvaccinated Marylanders live, and we also have a solid picture of where they might go to be vaccinated. We're right now working on developing an understanding surrounding precisely why they have not been vaccinated yet, and this is key information that we need to help get more shots in arms. We've targeted community-based efforts, including mobile clinics at a variety of locations such as festivals and county fairs, all of which are on our summer GoVax tour, and other events are part of our plan. In addition, we also have a form in English and Spanish for any organization to request a mobile clinic. That's at governor.maryland.gov/GoVaxMobile, and that's the link. And they can also call our call center at 1-855-MD-GoVax. Last slide. I wanted to touch briefly on vaccination incentives. That's another way we're drawing in the unvaccinated through partnerships with the state and businesses. We have community-based clinics set up at businesses like Compare Foods, opened by Maria and Leo Pena in Baltimore City and Prince George's County, and they're offering 10% off your purchase if you get vaccinated. A partnership with the Orioles, who offered tickets to anyone who got vaccinated at Camden Yards during their 2 recent homestands, and we vaccinated several hundred people through that effort. Of course, Lito's Pizza gave away 10,000 pizzas, and we have been partnering with the Maryland Lottery to give 40 lucky vaccinated Marylanders $40,000 each. We're well on our way through that process, and next Sunday on the 4th, we'll be concluding with a drawing for $400,000 on July 4th. We discussed this idea the last time we met, and we hope to announce additional incentives soon. So I'm going to stop there, Senators. Thank you so much for taking the time today. I know it's the middle of summer, but we really believe that we got a lot more work to do, and we're not going to slow down or stop until we get as many people vaccinated as possible. I'll stop there. Thank you.
Thank you so much, Mr. Secretary. And we're going to go slightly out of order. It looks like we do have Mr. Powell back. So before we jump into questions, Mr. Powell, do we have you up? It looks like he may be frozen. We'll check in to see. He may just go on voice as opposed to video. We'll check in. It appears not. Okay, let's go into questions, and we will, if we get Mr. Powell back, we're having an electric problem, apparently. Somebody called BG&E, we'll hopefully get him before the hour is out. So thank you, and thank you for the progress that's being made. I'm getting two major questions from constituents that may not have answers, but I just want to sort of flag them for things that I think are going to continue to be. Do we have any word or plans for the under 12? The next round lower? Has the department got any word from CDC? I think we have you muted, Mr. Secretary.
Okay, can you hear me now, President Ferguson? We've been tracking that with the federal government, and our understanding, unfortunately, I wish it was different, is it may not be until late fall or spring. So, of course, they've got to go through the testing process. We don't want them to take any shortcuts, but that is what we understand. I'm hoping it's sooner, but that's the latest we've heard.
And is there any sense of, I will be the first one to say we have got to have schools open. Do we have any thought about the impact on that with school reopening? Well,
the good news is that middle school and high school will be covered by 12 to 17, which is why we're really driving that population. Of course, the elementary schools, we have got a major program with the school systems around the state to work with them on testing as one option. We're giving them PPE so that they have that. But we are keeping our fingers crossed. The expectation is we're going to open all the schools.
Yeah. No, I think that's right. I think the testing is probably going to be the crucial component there, as much as humanly possible. The second question that I've been getting, and again, this is probably one of those ones where the science is kind of the question mark, but a lot of questions around booster and need for booster shots, and if there are efforts of kind of planning. I mean, I assume that there is a booster is going to be required. I don't know that to be true. And then if so, are we starting the plans for the booster program?
In our discussions with the White House, they have said that they believe there's going to be a need for booster. They are putting in place plans. It's their intent to provide us with the vaccine. That was as of 2 weeks ago. We're continuing to monitor that. My understanding, and this is not for sure, is that the likelihood is that the booster shot would be a one-dose shot, but we do not have that locked in stone yet, so we're still monitoring that issue also. But we definitely, and I will say the other thing that we're very concerned about, as I might have mentioned the last time, is flu. We're looking at the flu surge, particularly in the pediatric population. And that's high on my list of concerns. We're still monitoring adult surge, which would be both COVID and flu. But I think we're really focused on trying to understand the pediatric flu impact potentially.
Great. Okay. Thank you very much. We are going to do, let's check to see, do we have Mr. Powell? Nope. All right, let's go through questions. And if we can get it at the end, we'll get the update on the data side. The good news is that there's good news. Things are going in the right direction, largely. All right, we will go with Senator Rosapep, followed by Senator Young, followed by Senator Washington, followed by Senator Lamb, finishing with Senator Eckardt, if she is able to join, if she has questions. And so let's go to Senator Rosapep.
Thank you very much, Mr. President. And thank you, Mr. Secretary, for working with us, particularly in Prince George's County and the hard-hit areas. I think the department, as well as the Prince George's Health Department, have made big strides in terms of actually partnering with community groups. I've been out to a number of these occasions, and it's working. I mean, the model is there. The challenge is the scale up. One of my questions, I've asked this of the Prince George's Health Department, now that we know how to do it, now that we know where it is, are we setting zip code by zip code goals with timelines, the way you do when you're selling anything or when you're campaigning for office. I need this many votes by this date out of this precinct.
Right.
Seems like that's the time to do it. You don't achieve goals you don't set. And so is the state health department working with local health department to actual set performance goals for how many people vaccinated where, when?
Well, let me start by saying we are analyzing the zip codes, and so we do know that. I'm a little hesitant to be setting performance goals for the local health departments because they usually are accountable to their local jurisdiction. However, we are continuing to press. We just had a meeting last week with the 5 major jurisdictions that still have the most unvaccinated. Prince George's County was one of them, and we're starting to have that conversation, but in a partnership way. We don't want to be.
I'm all for partnership. You can set goals together, but I don't want nobody setting goals. So I would encourage to get together. And so the next time we get together, I'd love to hear exactly what the goals are, zip code by zip code, for targeted areas. That was number one.
Can I mention one other thing, Senator, along the lines which we've also been pressing to get resources for translators, because we've learned that we need translators, and we're going to be providing the resources to get that done. So right now, as a matter of fact, when we get calls, we have a resource to deploy that. So that was your suggestion. I just wanted to let you know.
I really appreciate you. You took that on, and people weren't thinking about it, and so I appreciate you taking it on. It's critical. I'll just give you an example. It's not just Spanish translators. We have a significant Mayan population in Maryland, and so the Mayan League is out there doing translation in their language because a lot of their folks don't speak Spanish and don't speak English. And I'm sure we have other minority languages like that. So the translation thing, I think, is incredibly important. So thank you. Second thing is, I understand that we don't have good data exchange with our neighboring states. From talking to the Prince George's Health Department, they say a lot more people have been vaccinated in Prince George's than the state number shows, but a lot of them have been vaccinated in DC. And so I say, how many? And I don't think, at least so far, I haven't heard anybody give me a number. Where are we in terms of exchange of information with our neighboring states? And we know a lot of Virginians got vaccinated in Charles County about 2 months ago.
Right. That's a great point, Senator. I got to tell you, it's one of my greatest frustrations that we don't have that data exchange. CDC has all that data, and heretofore, we've been hoping that they would help us. We did, so I think what we're going to have to do is start going to the state directly, and we'll have to do some data use agreements to exchange the data. It just makes it a lot harder, and I was hoping up till now that maybe we wouldn't have to do that, but I think we're at that point.
Well, I appreciate that. Maybe, Mr. President, perhaps we could do legislature to legislature in terms of trying to get that kind of shared information, because it is important for us bordering regions.
Certainly.
2 last questions. One is, what is the discussion on making vaccinations mandatory for kids to come back to school in middle school and high school? The universities are making it mandatory to come back to college. Where are you in discussions with school systems of making it mandatory for kids to come back into the classroom? We require vaccinations for everything else for kids to go back to school. Where are we in requiring it for COVID?
Yeah, well, step number one is, as you know, the local school boards generally make these decisions, and we've been reluctant to, get involved where the local decisions should be made. We've also been encouraging employers. So USM did it, and they're to be commended. And recently, you probably heard that the hospitals have taken that step.
Absolutely. But
and they have the authority to do that through the EEOC laws. And so we've been facilitating, but we have not been mandating.
Well, I'm not suggesting you mandate it, but I am suggesting that you take leadership. They look to you for health leadership and health policy leadership. And so I would hope the state health department would be encouraging. Last item, I love to see what you're doing on incentives. And I really believe that for a lot of the people right now, not the anti-vaxxers, not the COVID deniers, but the people who are on the edge, there's a lot of evidence over all of human history that paying people money and giving them stuff encourages them to do things you want them to do. And so do we have a strategy beyond the good examples, which are great? I saw this week that Anne Arundel County is launching a comprehensive incentive program for businesses that says any business which gets X number of people vaccinated, either customers or employers gets this amount of money, they get more, they get that amount of money. Looking at that statewide?
Well, our strategy so far has been to encourage employers. We've been talking to them, calling them. We're hoping to get more. We just had this week, we were down at the port providing vaccines. So it's a step-by-step process, but we really believe that the next big thing will be employers. And we're hoping and we're encouraging them to do that.
Well, I would just leave you with this thought. With all the money that Joe Biden and the Congress has gotten you and your department and the state to get people vaccinated, I would hope you would look at actually financial incentives for employers, for restaurants, for places that can then share that with their customers, with their employees. Because I think we're past the point of people who are ready to get a vaccine. They need an incentive. An incentive of money often is very effective in life. So thank you very much, Mr. Secretary. Thank you, Mr. President.
Thank you, Senator. All right. Let's do, we may have Mr. Powell, but do we have Mr. Powell now?
I am here by phone and I'm happy to walk through that presentation if you can hear me okay.
Yes. Can you see it?
I can.
Excellent. All right, let's do this very quickly. Feel free to skip any slides that you feel are superfluous so we can get back into question, but it is helpful to have the data. So go right ahead, Mr. Powell.
I'll be very quick. So since vaccines became available, positive cases are down 98% and the positivity rate is down 92%. Next slide, please. That's a graph of that positivity rate. You can see how quickly it's come down even since mid-April. You can go to the next slide. This is COVID cases recently, and I don't want, the darker zip codes have a higher rate per population, but it is still very low everywhere. Those are just the places where it happens to be the highest. I know the eye is sort of immediately drawn.
Mr. Powell, did we lose you? It appears we may have. All right. We're going to call it a technical glitch and give up. Oh, wait. Oh, there. No.
I'm still here. I can't see the presentation.
There it goes. Okay.
Of rural electrification.
All right. Last try. Last try.
Can you hear me?
Yes.
Okay. Let's go 2 more slides. One more. Yeah, that's the one. This is the case rate by age. It is low for everyone. There's no meaningful difference between the age cohorts at this time. Next one. Same thing by race. That blip for the green line, which is Asian Marylanders, I can't explain that. That's just something in the data that's strange, but you can see low COVID case rates by all races and ethnicities. Next slide, please. This shows the positivity rate and the death rate. Since 12-14, deaths, I think, are averaging about 3 per day recently. Next one. Same thing for hospitalizations. I think it was down to about 112 or 115 people currently hospitalized for COVID in Maryland. Next one. This is the vaccine trend. I think recently we're averaging around 14,000 a day. It's obviously down from the peak, but it reflects the number of people that have been vaccinated already. Next slide. This is vaccination rate by zip code. It's a similar story to what we've seen before. I also note when I look at this that it looks like on the Eastern Shore, particularly along the Delaware border, some of that may be influenced by Marylanders that went over to Dover or Newark or somewhere else in Delaware to get a vaccine. It may not be. That may also be the case in the DC area as well. It would be great if we knew that at some point. Next one. You can skip these next 2, which are just a zoom in on that. This is where Maryland compares to other states. I think we're 8th in first doses, 11th in second doses, at least as of late last week. You can see Vermont is sort of the leader amongst all the states in both of those things right now. Next one.
It appears we may have lost him again. Why don't we quickly go through the slides? If we could just, if there are any.
This is
I'm back. The only one I want to point out is the last one, maybe.
Okay, let's go there. And we'll make these available on the website too, so that we have it.
Yeah, that's the one I wanted to see. So this is data we've looked at before, but in a slightly different way. So the further to the right a jurisdiction is, that is the higher, let's see, recent vaccination rate. And the higher you are on the graph, the higher your cumulative rate. And so you see Montgomery County in the upper right, they have both a high recent rate and a high cumulative rate. And then if you look on the bottom left, you see Garrett, Cecil, and Allegheny, which both have low cumulative rates and low rates recently. So it's just a different way to sort of look at how jurisdictions have done to date, and also how kind of fast they're running at the moment. Sorry about the technical difficulties. That's all I wanted to share.
Excellent. No, that's an interesting one. The trends that emerge are, they tell their own stories. It's interesting. All right, Senator Washington.
Thank you, Senate President, and thank you, Secretary Shader. And absolutely, we're going in the right direction with the positivity rates, the test declines. Well, I'm not sure about the test declines. I mean, I have a concern. I guess that's one of my questions, and I know others have asked about it. We're being told fewer, people are taking off masks, people are being vaccinated. And at this point, I think the CDC is still encouraging people to wear masks and to socially distance in certain contexts. In addition to thinking about a booster shot, is there any thought about how do we ensure, or how do people make sure that we remain negative? Is there any? I don't have an answer. I'm not sure if anybody's talking about that, but how do we do sort of an ongoing assessment before people get sick, or, people just assuming that because they've been vaccinated that they can't transmit it or receive it? Any thought on that?
Well, I think thought number one is I think I started earlier by saying that we're nowhere near declaring victory. We need to continue vaccinating people, and that's the messaging. I think the messaging continues to be, if you are unvaccinated, you are at risk, and we just want to keep driving that. And I think if we keep doing that and getting people vaccinated, it'll help us. As you said, though, we are worried about the Delta variant. And we are worried about the fact that until we get the vaccine for children under 12, that they are still potential spreaders. So, but if we vaccinate the bulk of the population, like I said, I'm really been encouraged by almost 50% of the 12 to 17 population getting vaccinated in a very short period of time. And so we're continuing to drive that. Very excited by the 91.7% in the 65 plus population. So our focus is, and I think where we can have the most impact, is continuing to drive vaccination.
I guess I would I know we're shutting down the mass vac sites, and you're investing more in mobile units and putting it into the community, which we've said all along is the way to go. And then that's really great. I guess my question was, and we can talk about it later, but if people aren't getting tested at all, it's possible that we may be missing some positive folks that are positive, particularly in areas that are under vaccinated. So I'm just wondering, do we see, in addition to focusing on those zip codes and areas on the map where we know they're under vaccinated, are we also encouraging or shouldn't we be encouraging individuals to get tested as well? So
yes, I didn't understand your question.
Sorry.
Absolutely.
Because
absolutely,
tests are going down, but that's not necessarily always a good.
Right. So what we are doing, for example, when we are, as we're shutting down, as you've probably seen, the convention center, we are working with Hopkins and and our team to find another central place to keep the testing, vaccines, and monoclonal antibodies going. So that is a priority, and we are still, and even though the numbers of tests sometimes are down to 10,000, we're seeing very low positivity rate, but we are going to continue pushing testing. So I hope I didn't give the impression that testing wasn't a priority, because that's not the case.
Also, I'm not as up on asking you questions because I'm not doing it every week. So like we were before.
No problem.
And then I'll have an equity question and then sort of a logistical one. So Maryland makes up, is in the top 5. It's 5th in terms of ranking of African Americans in the overall population. So our rank is 6th among vaccinations among African Americans. Still says we're behind where we should be as a proportion of the overall country's population. So we still have a way to go. We still have that racial disparity. Again, it's much smaller, but in my city, even within my district, we see that there's under vaccination in communities of color, in low income communities, in communities that don't have access to transportation and don't have a lot of trust at times of the state government. So I guess that's we need to continue to do that. So on that issue, my delegation and I and the city and lots of people, we've been working on vaccine distribution within our district, inspired of course by, Senator Rosa Pepp and others. And it seems that the process to request a mobile unit can take a while. So I'd like to, sort of highlight that as something to maybe streamline a bit. You have to fill out a form, you have to wait a while. It actually took a month before we got feedback, before we got an answer about getting a mobile vaccination unit. It seems like Steve Richards, I don't know if that's the main point person, but who is that point person? And if we're going to invest in these mobile units, we really need a quicker turnaround than a month.
Yeah, I couldn't agree with you more. We'll check into that because that is definitely too long. It needs to be quicker. Steve Richards is the point guy working with Assistant Secretary Jeff Wolford. So we'll make it a point to follow up on that.
Yeah, so we put up, and so we did an earlier one, and then we had a call 6/17, and so we're trying to get.
Yeah, I think you have a second request in that we're pushing.
Well, we're trying to vaccinate as many people involved.
I love it. Yeah, no, I was just asking about your request last week, so we really appreciate it.
All right, Mr. President, thank you so much. Thank you
so much, Senator. Senator Lamb.
Thank you, Mr. President. Thank you, Mr. Secretary, for being with us again. I had a question about some of the areas that I think Mr. Powell cited as being counties that have low rates of vaccination, and kind of drawing the analogy to kind of what we're seeing on the national level as well, where there are certain states that are behind other states when it comes to vaccination, and a particularly, I guess, concerning pattern where oftentimes these are states that are more red leaning or Republican leaning, or some of these more rural states as well. We're seeing that analogous pattern on the state level where some of the counties that are least vaccinated are ones that are also more red leaning as well as more rural. And so I'm concerned about this because our population is mobile, right? And so, people don't make decisions on where they go, work, or play based on their county. We have populations that, they may live in a rural county, but they work in a suburban or urban area. And so these populations are crossing paths. This pattern where some of the more red-leaning counties have low vaccination rates and some of the more blue-leaning counties have higher vaccination rates, I think is kind of troubling. What do you attribute this pattern to, and what are you trying to do to increase the vaccination rates in some of these low rate counties?
Well, first let me say that our approach to every county is red, white, and blue. They're all American citizens. So that's the approach we're taking. And we are using, and actually Senator Rosa Pepp sent me a really good article about a month ago on the profiles of the 4 categories of people who are not getting vaccinated. And we are actually doing some survey research to follow up on that using our call center. But you have people who either are worried about the cost because they don't know it's free. We also are looking at folks who may be hesitant because they don't trust the health system. And those four profiles, we're looking at how do we break into that. So I think we're not giving up on any county. We're looking across the board. We want to use the health officers to help us, and we're engaging in every county. We're gonna keep driving. Our numbers are really excellent, and we're gonna continue to vaccinate people regardless of the county.
Are you doing any particularly special outreach type methods or activities to some of these low vaccination counties like Garrett and Allegheny, and I think Cecil's in there too, and there's one over in the Eastern Shore that have high pockets of unvaccinated residents?
Yeah, well, you might recall, I actually made a personal trip out to Western Maryland and talked to a variety of people in the community, talked to the fire services out there. So each jurisdiction is going to require a different approach. We managed to get one of the pharmacies, PharmaCare, out there to engage with their local nursing homes and assisted living. So and on the Eastern Shore, of course, you know, we've been going into those jurisdictions very directly and talking to either the elected officials or the health officer, trying to figure out what might be the best approach to each jurisdiction. So we're not gonna leave any stone unturned.
With the mass vaccination sites, I guess, shutting down mostly and resources being allocated elsewhere, one, can you kind of account for where those resources that used to be focused at these mass vaccination sites have now been redistributed? And two, has there been any thought about redistributing and concentrating some of those resources in these low vaccination rate counties?
That is precisely what we're doing. We had an inventory. You probably heard the governor say that at its peak we had about 11,400 people working in the enterprise. We've been working with MEMA, tracking how many people are going to roll off from mass vax, and the Guard, of course. The Guard will be cycling out. But while we're doing that, we've established a recovery process with one of our key directors, John Weinstein, and we're working with MEMA to make sure that we capture the people and get them redeployed onto the community vax program. So you're right on the money. That's exactly what we're doing.
And then a technical question is, you have cited we want to get more businesses or employers as appropriate to require vaccination of their employees if that's the case. So we've had some higher ed institutions that you cited, as well as some health systems that have moved towards requiring their employees to be vaccinated. One technical concern that has come up amongst these employers, because they oftentimes have occupational health departments or offices that are able to access Immunet data, which is kind of the source of truth for who in the state has been vaccinated, of course. However, because the Immunet data is coming to them in a way that there is no agreement for them to be able to access that information in Immunet for occupational health purposes, the employers are having to have their employees basically self-submit documentation, which is a very cumbersome process for them to say, okay, I was vaccinated at a mass vac site, or I was vaccinated at a CVS, et cetera. Is there any way to be able to update the agreement that the folks that have administrative access to Immunet to be able to allow them, with the patient's or employee's consent, to be able to access Immunet data for verifying that they have been vaccinated to meet some of these employee mandates for vaccination? I don't know if that makes sense or not, but happy to talk.
Absolutely. So for about a month now, we started working on this problem. There's a couple different ways to go, and I expect by next time we chat, we'll have a solution. But you're you're right on the money. How do we let employers get access? You mentioned one avenue, which would be with patient consent. And then there are other approaches that we're looking at to accomplish that record access. So I hope to have more about that the next time we talk.
Okay, last question, and thank you, because I think that would be really helpful. Are you tracking breakthrough cases, and are you sequencing or going through a process of sequencing some of these breakthrough cases? Because we know there have been people that have been fully vaccinated that have gotten COVID. And I think it's important to track these breakthrough cases and then also have continued sequencing of them so that we know where they are, what's occurring here, and are they the concerning Delta variant. Can you speak to that?
Yeah, we have been doing exactly that. We have data and reporting. I don't have it with me today. I'd be glad to bring Dr. Chan on for our next call to go through that in detail, because that's an important element. And we're one of the leading states in the country for doing sequencing. So why don't I get that teed up for our next call?
Okay, yeah, if you can speak to the breakthrough cases and sequencing in the next call, that'd be helpful. Great. Thank you, Mr. President.
Absolutely.
Excellent. Thank you, Senator. All right, we have Senator Eckardt on the phone. Senator Eckardt, you have to press *6 in order to unmute if you want.
I am unmuted.
Excellent. There we
Greetings,
are.
everybody, and thank you for bearing with me. I've been trying to get access, so it's been a challenge. But Mr. Secretary, thank you so much to your team for all the good work, and as usual, the health departments. We have just had a tremendous team on the ground. Unfortunately, if we had more translators, it would work a little bit better. If you have any extra Haitian Creole-speaking translators around who helped with the census, we could use them on the shore. But we've been diligently working, and actually it's been one-on-one with good success, getting people convinced to go ahead and get the vaccine. So I know that's been happening in Wycomico and in Dorchester County, so that is much appreciated. But we will need to be continuing the effort in response to which populations are resisting for which reasons. I'm telling you, I have family members in Western Maryland who are not interested in getting the vaccine, and I've talked to them blue in the face. I have family members on the West Coast, and it's gotten to be a family tense issue because there is some mindset out there in many people that this is not safe. There's not enough information, and so I think it's continuous good information coming forward to be able to promote understanding that it's really important to be vaccinated. So I would just say we're going to continue to need resources in our areas, particularly the rural areas, to be able to continue to educate and persuade people that this is absolutely essential to get the vaccine.
Yes, ma'am. Thank you for that, and I appreciate the heads up on Creole and Haitians. We will follow up on that. One thing we have in talking to employers, I recently talked to one employer who said that they had 90% of their staff vaccinated, and I asked them how they did it, and they said they committed to ongoing, continued education, not pushing people, but educating them, and they've managed to really break through to 90%, which is really terrific. So we will definitely continue with that recommendation.
And I think some of the other issues are going to lead to what we already know with inadequate health delivery, particularly in the Haitian population. You know, culture is such a very, very important piece of personal health. And so as we develop and we have resources to do that through the legislature, I'm grateful for, to be able to do kind of specialty health delivery and the creation of community health workers we're going to try to do something, putting together some resources here on the shore so that we can kind of grow our own indigenous community health workers in our specialty populations. And I think any way that we can expedite that is going to be really important.
The trusted validator.
Thank you for that,
go ahead,
Senator. Appreciate it.
Thank you.
Thank you very much, Senator. I think I hit the nail on the head with the trusted value. Every sort of anecdotal and everything I read, it's all about the closer someone is, that's the highest likelihood of shifting, and the primary care doc. Just have such a
that's right.
The flip. Well, thank you, senators. We do not have Senator Young, who was unable to join. If there's a last second question before we go, we have about 2 minutes here. Senator Roosevelt.
Yeah, I have an encore question dealing with the language. If you haven't done it, Mr. Secretary, I would encourage you to do a top-down analysis of languages spoken in Maryland. I didn't know we had Hmong speakers from Maya, from the Mayan areas of Guatemala. I knew there were Haitians. I know there are a lot of different kind of languages. I think it's something that could be looked at from the top down, from census data and other things, and then you could identify ahead of time, so we get ahead of the language problem. There probably are easily dozens and dozens of languages we really actually need translators for. So just a suggestion.
Yeah, thank you for that, Senator. That's a great point.
Looks like we have one final question from Senator Washington.
It's a cosign, and it builds on Senator Lamb's asking about where are we going to reallocate, and it builds on what Senator Eckardt said, that investing in community health workers. I know, for example, Morgan State University, there's community health, the University of Maryland has community health all over. If we can move that money and invest in our community health workers, particularly the evening programs, and we have multiple nurse training programs in our community colleges, we can reallocate that money and build those folks who will be in place when we need them again. I think that's the way. So I'm going to co-sign that and say if we could focus on that, I think that would be will really help.
Thank you very much, Senator.
Thank you, Senator. All right. Well, that concludes our hearing today. I just want to say thank you, Mr. Secretary. It is, it is amazing what the difference can be in a year. Going from where we were to where we are. There's still work to do, as you mentioned, but it's just pretty remarkable to see the progress, and it's a testament to Marylanders stepping up, rolling up their sleeves, getting that vaccine, and we will all continue to work in partnership to make sure that anyone that wants it and those who need to be convinced that we find a way to get them vaccinated. So thank you, sir. Thank you, senators. It's a pleasure to see you all.
Thank you.
And we will see you all soon. Take care.